Hi, today we present to you a video on congenital heart defects. There are many different types of congenital heart defects that may develop in a fetus. We'll start off by talking about hypoplastic left heart syndrome. This is a congenital heart defect that during the gestation, the fetal heart is undeveloped on the left side. This issue makes hypoplastic left heart syndrome a serious condition to have and considered one of the most severe congenital heart defects. The left ventricle, the mitral valve, and the aortic valve are undeveloped. As a result, blood cannot be adequately pumped throughout the body. HLH syndrome is present at birth with no known cause. This can be fatal. Surgery must be done to repair it. Surgery starts from at birth all the way up to the age of 3. Risk factors. Risk factors may include genetics. HLH syndrome appears slightly more often in boys than in girls. Beyond family history, there are no clear risk factors for it and no known way to prevent it. Lifespan considerations. As infant to toddlers, corrective surgery is done. In long term, these children have increased risk of complications such as heart failure and heart rhythm problems. Throughout lifespan, there are a risk of digestive and liver problems. Individuals with HLH syndrome have low exercise tolerance. Some children will need a heart transplant to survive into adulthood. Nursing, assessment, and interventions to include in the teaching plan. Assessments include vital signs, ECG changes, assessing for decreased peripheral pulses, assess the heart rate, note skin color, temperature, and moisture, inspect fluid imbalance and weight gain, provide adequate rest periods, position the child in the semi-fowlers, and administration of oxygen. Refer the family for additional support and counseling if indicated. Instruct parents into nutritional and activity needs or limitations and approaches that will assist in establishing an effective pattern. Encourage family members to interact with the child as much as possible. Diagnostics and labs used to identify the condition. Chest x-ray shows the cardiomegaly and increased pulmonary vascularity. Echocardiography shows the small left ventricle. Diagnosis may occur prenatally during the routine ultrasound scans. Cardiac catheterization may be performed in preparation for surgical intervention. An atrial septostomy may be considered to promote homogeneity of the blood. Labs, BNP, troponin, C-reactive protein. Clinical therapy, infusion of prostaglandin E1 to promote an open pathway. Supplemental oxygen to take stress off the ventricles. Treatment options include comfort and palliative care, the Norwood, Glenn, or Fontaine procedures, depending upon the child's age, and then a heart transplantation. Surgery is performed in 3 stages. Norwood procedure. This is first week of life, followed by the Glenn procedure at 3 to 8 months, and then the Fontaine procedure between 18 months and 3 years of age. It's a very complex treatment. The surgeon redirects blood flow into the lungs and the body. Heart transplantation is very limited.